with the exercising abundance of caution with Dr. Reynolds, just as the chief advisor to the mayor, health advisor to the mayor for the city of Flint. He's my city doctor. I'm sorry, Doc. And then, of course, Dr. Hackert reframing and helping us rethink about the role of public health as we move forward. Then if you do that piece you're talking about, because it gives us a sense, and it really fits into something that's going to happen in the conversation, I think, about the watershed, that things are, wastewater, that things are happening continually that we have not been made aware of, that have some relevance here. And then what's next from an epi perspective, and that'll be Dr. Verholden. That makes sense?
I apologize. I missed the introduction of Dr. Ram, but the city of Flint is participating in a wastewater study through U of M.
Yes, he's got that. He's got that noted.
I actually have that slide there in answer to a question. I looked it up on the state site.
Thank you. And do you have the Swiss cheese model? Does Heatherland or you have the Swiss cheese model that you can share during what I say? Because a picture is worth 1,000 words and my face is worth 10 cents.
We'll do our best.
Heatherland's gonna work on that for us. Thank you, Heatherland.
Bless you.
I think I heard on the radio yesterday somebody talking about the Swiss cheese model.
Yeah, I borrowed it from some Australian virologists and epidemiologists more than a year ago, and it's still valid.
Oh, of course it's valid. But that, I thought, what a coincidence. You just mentioned the Swiss cheese model, and I think I heard somebody say that yesterday as I was leaving work.
All right. And look out for Dr. Walford, because she'll make you look at food and kitchen preparation devices completely different.
I bet.
Yeah, so Dr. Ram is joining us today from Wayne State University School of Medicine. You have some fans. Wayne State has some fans.
Wayne State undergrad.
Yeah, he was.
Oh, great, great.
We got connected with Dr. Ram through Dr. Kilgore. And so, yeah, so we're looking for some more interesting information today.
And I'm sure you've met Dr. McElmurray.
Oh,
Sean,
yes.
Yes. Sean's been here with us before as well. Good morning, Jim. Dr. Hacker, good morning.
Good morning.
So we got two more minutes.
So you guys don't hear my dog barking when someone walks by.
We got 2 more minutes to say good morning.
Good morning, everybody.
Good morning, Katie.
Morning.
Hey,
Good
Sherelle.
morning.
Good morning.
And is that Dr. Youssef is a Wayne State person too?
I am not a doctor yet.
She is a future doctor. I will introduce her about 3/4 of the way through the talk.
I just had to go there. I'm sorry.
Project Communicator. She's a future Wayne State doctor.
Recording in progress.
Wonderful.
She's a public health major.
Excellent.
Sorry, can people hear me?
Yes, Dr. Hacker.
But yes. I'll go on mute now.
Hey, Joanne, good morning.
Good morning, Yvonne. Good morning, everyone.
Good morning. Hi, Perlita. We're taking advantage of these few moments, seconds now, morning. Hey, Kiana.
feel like we're about to launch to the moon.
We're on our way.
I blockade my dog out of the room.
Well, good afternoon and welcome to week 105 of the Flint Community Webinar on Coronavirus. We're so excited that you joined us today. This webinar is sponsored by the Flint Center for Health Equity Solutions, the Healthy Flint Research Coordinating Center, and the Michigan Prevention Research Center. I'm so excited that you have joined us today. I'm Yvonne Lewis, the moderator for today. We actually said earlier, we're in week 105, and we continue to appreciate the number of partners who join us every week. And for those of you in community that join us every week for this webinar, our goal with this webinar is to bring a local context to a global pandemic. Today in our session, we have some very important topics that we're going to cover with you. And we hope that if you have questions, you'd include those questions in the chat, and we will be happy to answer them for you. Our dynamic team of participants today that are on our panel will bring some very, very important information to you. We're going to talk today about just a really quick COVID update. What's the status check? We're going to talk about a really important topic that many of us may not have heard about, but testing of wastewater in order as a surveillance method for COVID. We're going to have updates as we do every week from the health department, from our city of Flint, and we're going to have an update from our health equity brief. I like to call our roundtable together this morning. We have so much to cover for you today, but I'd like our roundtable team, Dr. Wolford, Dr. Hacker, Dr. Reynolds, and Dr. Furholden to come and chat with me for a few minutes. We are in some changing times. We talked about this before, changing times, similar to the water crisis. And I even reached way back, chatting with Dr. Reynolds, reached way back to the crisis when General Motors left us. And now COVID, everything was in the news. It was top of billing for a long time. And then it kind of shrinks out of exposure. So when it fades away, what do we as a community do? And so one of the things we want to talk about today is we want to talk about exercising the abundance of caution. In our roundtable, we'll also ask Dr. Hecker to give us a little update and perspective on the role of public health department as we move forward. Dr. Wolford, you get ready. Dr. Wolford's going to give us a quick medical moment, even in the roundtable, and we'll follow that with an update from Dr. Deborah Holden looking at the epi. Where are we going from here? So let's start with you, Dr. Reynolds. In this shift and the fading of COVID in popular media, how and what do we do to exercise the abundance of caution?
Well, first I must say the pandemic is far from over. We have survived a surge, but if you will note, the COVID virus variant is spreading in Europe, and 23% to 25% of the cases in the US are now due to another variant. We don't know how that will work. And if we look at the new recommendations, I think I would like to flip them. Okay, first we need to talk about vulnerable populations, because people think, well, I'm not vulnerable. But if you are unvaccinated, partially vaccinated, if you have a chronic medical condition, if you're like me, over age 65, if you have relatives in your house who are over age 65, if you are with someone who's been immunosuppressed, immunocompromised, either because of cancer treatment, disease, or whole organ transplant, you must look out for those people. And the vaccinated. 40% of the people in Michigan are not completely vaccinated. So we still have to protect those folks, including children under 5. So you must still practice with As my colleague has said, an abundance of caution. And I'd like to bring that Swiss cheese model back to our attention, because we have tools. You don't say you're going to go out and grow a whole crop of anything without the proper tools, right? So we have tools, and I want you to think of this every time you walk into the supermarket. We have personal responsibilities and shared responsibilities. And if you look at the lady standing on the right, she has had vaccinations, and now we have therapeutics. We have support for quarantine and isolation. We are getting government financial support that covers the cost of these tests and vaccinations. And we're getting regulations and messaging, even though they're shrinking. I'll speak for my other colleague in public health, Dr. Hackert. It says depending on local conditions. So don't come jumping up in people's face when they say local conditions dictate we do thus and so, because it's dependent on local conditions. There's another big issue that we have yet to sufficiently address, and that's indoor ventilation, air filtration, and recognizing that outdoors is usually best. And then we have the access to fast and sensitive testing. Try out your home test kit. If you don't have one, get on that email, make that phone call and get one. But still, you got to use your brain. Avoid crowds and unmasked groups, especially of people for whom you don't know what their vaccination status is. You don't know if they're symptomatic or not. So use good judgment. I had a family funeral yesterday, and it was done by Zoom just because we don't know all the friends and family's vaccination status. Wash your hands, cover your cough and sneeze. I will still wear a mask when I'm in a situation where I don't know the people, and maintain physical distance when you can. And if you can't, reevaluate that setting where you are. And please stay home if you're sick and use that home test kit.
Thank you, Dr. Reynolds. Thank you, Dr. Reynolds. A good segue. You talked about use that in-home test kit, talked a little bit about public health precautions. Dr. Hackert, help us just really quickly get a sense of what's the role, what will be the role or the continued role of the health department during this transition?
So I'm not sure how familiar people are with the changes that the state put out in terms of, their overall picture. But now it's readiness defined as pre-surge, response defined as what you're doing during a surge, and recovery in post-surge. And we are now considered to be in a recovery phase. Now, most people interpret that word, if you keep it that simple, the readiness, response, and recovery, as a time to go, oh, thank God it's over, and it's not, that is actually not what their intent is. They want you to take a moment to perhaps have a little bit of ease, but really it's planning for the next surge is what they want to say that this is. And so when they say it's post-surge, it's really, for those of you who are in public health with the pandemic, it used to have like the 5 different stages. It's really planning for the next surge. And so they want us to remain in this phase. But while we're in this phase, to encourage vaccines to decrease your COVID-19 risk when the next round comes, strengthen the community support with local stakeholders, exactly as Dr. Reynolds just said, and empower community members to make best choices for individual conditions. And so that is where we really need to let people start talking and getting the information that they may not have had access to during the surges, or they may not have time to have brought those topics up. But now that we can, be in this little recovery phase where we can really make the choices, make the talk, make the conversations happen that will empower people to be prepared for the next round.
Thank you, Dr. Hackert. And I know we got to have some information for our community about some other opportunities that'll be coming forward. Dr. Wilford, what's the medical side of this?
Thank you so much, Yvonne, for this chance to share a little bit about the medical side. And so I think when I think about COVID, as we learn more and more and more about it, I have more reasons for not wanting to get COVID. And I'll share one of them with you today. And for that, I'd like us to think about our brain. And maybe think of our brain as a cauliflower. Our brains weigh about 3 pounds, about the weight of a cauliflower. And over time, unfortunately to say, we don't quite lose our minds, but the size of our brains do decrease over time. And that impacts function. And we can see the difference, many of us, as we age. And I'm going to get to things that we can do to help prevent this. But one of the things that we learned in a study recently, a very interesting study out of England, is that COVID has an impact, or appears to have an impact, on the functioning of the brain and the size, how quickly we lose brain volume. So they were following a cohort, a group of people, actually they're following millions of people who've agreed to be part of this study over the years. And over the years, they've done brain scans on them. So they looked at the brain scan that they did prior to the person getting COVID, and then looked at a brain scan 3 years later after they've had COVID in between. And those people who had COVID versus those who did not have COVID in that time frame lost more brain volume, and particularly in the outer part of the brain. So when you hear these studies online, you'll hear them talk about the fact that it was the gray matter, that matter on the outside. I don't know if you can tell that this cauliflower is a little bit orange on the outside, a bit of a tan color, which is actually the color of that gray matter. It's not really gray, it's just gray because we dye it that way to look at it and examine it once you take a brain out. But it's white, and this white part in the middle is the white matter of the brain that deals more with connections and sending signals. And this gray, the fluffier part on the outside, that part on the outside, that gray part, which looks tan here, because that's the color it really is the part that deals a lot with emotion, controlling emotion and motor movement and things of that nature. And they've seen that those parts are more affected. And when they then tested to see if, in fact, cognition was the way we think was impacted, it appeared that it might be. Now, I want to emphasize that this is all very new. It is only 800 people that were in the study, and the findings are preliminary. So I don't want anyone to leave here thinking, oh, they're going to be dramatic impacts on my brain if I get COVID. It just looks like maybe there might be this impact. And it's just another reason why I don't want to get COVID. So we have to, as Dr. Reynolds says, use our brain and protect ourselves from being exposed and from exposing others.
Thank you so much. I don't know how you figure out how to take these folks, these pieces of food out the kitchen and make a medical message out of them. But thank you for that, because it is something for us to consider. And we'll talk a little bit more about other things we consider. Dr. Deborah, can you just talk to us a little bit as we're, again, the language is shifting, we're learning more, but what's the epi side of this? What does epidemiology studies, what are we learning from those types of studies as well as we transition?
I think there are a couple of things that are important to note, which is that we're following trends worldwide. I've been a little disappointed to hear how people have sort of talked about what's happening in Europe and in Asia as if it's no big deal. It's just now inevitable that it's going to be, happening here, because in the face of that, people are also peeling back protections. Mask mandates are gone. The push for vaccination doesn't seem to be as strong. And it's not just vaccinations now. People have to get vaccinations and they have to get boosters to get that full protection. And so I always tell people, I would love it if data drove policy, but unfortunately it doesn't. If you're lucky, you can use data to influence a policymaker and hopefully get some good policy out of it. But it doesn't stop people from still practicing their own good, sound prevention, because what is predictable, and I cannot wait to hear about the wastewater studies. As somebody who did drug studies, I will tell you, we look to understand community prevalence of drug use in wastewater. There's a lot of stuff that you can get and learn from wastewater. But I just, encourage people that, yeah, we're in a sort of case right now where we have much lower community transmission, but it doesn't take much for that to change. It really doesn't. And so I love Dr. Wolford's point. I could come up with many, many reasons why I don't want to get COVID. You know, we had a myth during Omicron that, oh, it's just like a cold. And that turned out to not be true for everybody. We had more deaths and more hospitalizations during Omicron, many more than we had during Delta. So I say we can let the data be our guide. Our rates are pretty low right now. There's indications that those rates are going to be increasing in the next several weeks. And we'll need all of those things back in place: the testing, the masking, the distancing, and all of that stuff. And then the last little bit of caution I would give to people is a part of, and this is why I think the wastewater work is so important. If you really want to understand community surveillance, community transmission, you've got to have great data. And we right now don't have great data. People have stopped getting tested. We've reduced the amount of testing. And so, I encourage people to just continue to practice those good preventive measures. And I am convinced if they could only do one thing, and they say I can only do one thing, it would be to wash your hands and wash them well. Everything starts with hand hygiene. Wash your hands. Even when you put your mask on, if you're putting your mask on and your hands aren't clean, you might be contaminating yourself and the mask through your hands. So just make sure you keep that practice in place as well.
Thank you so much, Dr. Deborah. Our roundtable, you all are just stellar as you are every week. We thank you so much. Exercising abundance of caution is the word for this week. We want us to take a look at that. And Dr. Deb, you gave us a great segue to our special guest today, Dr. Jeff Ram. Dr. Jeff Ram is from Wayne State University. He's a professor in the Department of Physiology. Now, one might wonder why we would be talking about physiology, but Dr. Ram can give us that clarity. But also, we want you to know that there are things that are being studied ongoing. This isn't just going to stop right here. It didn't start here, but they're using experience from previous examples to help us understand better COVID. So, Dr. Ram, we welcome you today and thank you. Appreciate Dr. Kilgore for making the connection. Dr. Ram.
Okay. Need to get on my screen.
Yes, you should go ahead and share.
Yeah. Okay, and everybody can hear me. And what can we learn? Dr. Deborah, that was a great introduction of what you had to say. And thank you for anticipating what wastewater can tell us about the community. And really, what can we learn? Why are we doing such dirty, smelly work as working with wastewater? And we could get into later how a physiologist is becoming a microbiologist, but come on, slides, go. There we go. So here are the reasons why we're doing this work with wastewater. We're taking wastewater from the community and we're measuring things in it. We use this to identify the presence of SARS-CoV-2, that's the virus that causes COVID-19, in communities. And it provides an early warning for an increase in cases because people shed virus into their gastrointestinal tract and flush it down the toilet often before they have any symptoms. It can also be used to let communities know of declines in cases or to confirm that and whether there's virus present. And you've heard from a number of people before me how it seems like we're going into a low time as far as the virus goes, but don't let your guard down. Spoiler alert, I'm going to show you some new data that causes me to have more caution than I did last week. And we use it to alert communities, hospitals, and public health agencies so they can get ready for surges. It can also be used for scientific studies to measure the effectiveness of the various mitigations. Each slice of that Swiss cheese, how effective are each of those? And people have done studies of those. And one of the measures is what's happening in the entire community as measured by the wastewater prevalence. And also, as you heard from Dr. Deborah, people may be doing more home tests so it doesn't get reported publicly. And in under-resourced communities, there may be people that don't test at all. If they think, oh, it's nothing getting COVID, I know what I have and I'm going to recover because I've been boosted. We may not see that as early as we'll see it with wastewater. This is my research group. They're not all working on wastewater, but Several of them are Sophia Yusuf, whom you'll hear from a little later. I'm sitting in the center. Azadeh Bahmani, Adrian Vasquez, and Nick West over here, and Mohammed Khan are all working on the wastewater project. And in fact, Orib Khan, who's standing there right behind me, he's working on it too, because he orders all the many supplies that we need. He's the business person for the laboratory. The other people in the picture are working on other projects, and Azadeh designed this beautiful logo that shows all the things that we work on. And the laboratory is doing a lot of different things. This is just a brief introduction to the sorts of things. First and foremost, for now, detection of, traditionally, up till now, up to the pandemic, we were doing some work detecting human sources of fecal contamination in watersheds and at beaches. So we knew something about sewage. So when the pandemic started, I consider this the Manhattan Project of our time. Any scientist who had a skill or method that could be used for helping to solve the problem of this pandemic, really, there was a moral obligation to do that. So we used our knowledge of sewage and how to measure things molecularly to do wastewater-based epidemiology. We also use those technologies for detection of vector-borne disease organisms, such as for Lyme disease. And there are other projects. The top three projects actually grew out of the bottom two projects, where we study basically out of curiosity. These are organisms hardly anybody has ever worked on at all. We study the diet and diversity of water mites. They don't cause any human disease, but they do eat mosquitoes, mosquito larvae. And we also work on extracellular calcium receptor. It's a kidney-related project, may have relevance to people who have renal disease. Here's our mission statement, but I know I only have about 20 minutes, so I'm going to skip through that. I've already given you an idea of what we work on, but here's a picture of where we do part of our work, manhole covers all around the city of Detroit. And there's a cartoon of what we're working on. Who's involved in this project? I'm the director of the molecular microbiology laboratory, but I couldn't do this project without somebody that knew a lot about sewers, and that's Bill Schuster, who's the chair of civil and environmental engineering. And so we've been working on this 50-50, basically. It's a collaboration between engineers and microbiologists, basically. So, and we interact with a lot of people. Before this project, I didn't work on viruses. I worked on bacteria and on mammals and invertebrates. So for the knowledge of viruses, I consult people in the microbiology department. Already mentioned, we go to engineering for knowledge of the sewage systems, and we collaborate very closely with the Detroit Health Department. They provide health information for us. We provide community data on where we're seeing SARS-CoV-2. The project is funded by the Michigan Department of Health and Human Services. It was actually initiated by EGLE, the Michigan Department of Environment, Great Lakes, and Energy, who was doing a lot of molecular work as we were on beaches, and they saw immediately and got together with MDHHS and said, we can do this in sewage because there's evidence that it gives early warning. And there's a website for MDHHS. I know you're not going to write this whole website down. Just look for Michigan wastewater testing and you can find it. And how do we do this? How do we know what the level of COVID-19 is or will be in the community? There's three major steps. We go out and we collect sewage through manhole covers. There are other groups around the state that go directly to the wastewater treatment plant. But you know, in Detroit, the wastewater treatment plant gets sewage. Well, you know this better than anybody else. I think you're still having, again, your sewage treated, it was the drinking water, excuse me. But Your sewage probably goes through Great Lakes Water Authority. And so they get sewage from about 3 million people. They divide it into thirds. So they're getting about 1 million people from each one of those collectors. We collect from sewer sheds, we call them, that have anywhere from 1,000 to about 10,000 people in them. So there's collecting, processing, I'll show you a few things on that, and then sharing the data. So I don't actually go out and pull the manhole covers. I worked with Limnotech on one of our bacterial beach contamination problems before, and they wanted us to look at a sewer in Ann Arbor, as a matter of fact, that might have been contaminating the Huron River. So I called them up when the pandemic started. I said, what do you think about collecting water so we can measure SARS-CoV-2? And they were enthusiastic about it. And then we found out that the state wanted to do it too. We go for sewer sheds. The little map here, that's of Detroit. And I've covered over the names of some of the sites there because some of them are associated with nursing homes or correctional facilities. And there's ethical and legal issues associated with advertising all the sites. But zip code wide sites, it can't be identified to any single person or institution. This is 48235. So the ones that you can see the levels, and also Wayne State. Wayne State makes everything public. They're transparent. And the types of sampling, we take grab samples. That means we drop a bucket in and we pull out the water that's going past right at that time. So we might miss something, or we might get it right when it's passing through. And we also do something that's called a Moore swab. It's a fancy scientific name for what are actually tampons, well-known devices for absorbing fluids, right? We sample for 4 dormitory sites at Wayne State and 16 other sites across the city of Detroit. Yvonne, how much more time do I have?
You've got about 5 minutes, Doctor.
Okay, thank you. Well, we'll get to the data soon because that's really important. And the samples are delivered to our lab. Upon delivery, it's processed by the people I already introduced you to. And that has 2 steps. We extract RNA. RNA is the genetic material of this virus. Not all viruses are RNA, some are DNA, but this one is RNA. And then we measure the amount with a special type of PCR called DDPCR. This is just a cartoon of the virus, just showing genetic material as RNA. And we use what's, from want of a better word, a robot to help us do the purification of the RNA. We have to do a little hand holding with it, put it into a tube, add a few chemicals, put those tubes on something to heat it up that helps the extraction. Then we put it in this machine that's over here on the right, and 75 minutes later, we have pure RNA from wastewater. And then we do a special type of PCR called DDPCR. It's explained in detail over on the right side here. But the important point about DDPCR, it is a more sensitive method than ordinary PCR, which is used for clinical samples. So we can detect the small amounts of virus, or the relatively low concentration of the virus markers in wastewater. I can tell you wastewater has lots of RNA. It's got RNA from humans, it's got RNA from bacteria and the virus markers. We need a very sensitive technique to tell it. This DDPCR machine, once we put the samples in, it's hooked up to a computer. Actually, it's a separate machine, a droplet reader. The DD stands for digital droplets. It's hooked up to a computer. It does some complicated statistical analyses of the droplets. And that's where our project communicator comes in, Sophia Yusuf. Sophia, you want to give us what you have to say about how you communicate? I'd like to introduce you to Sophia. She's an undergraduate. She's a MedDirect public health major. This is a great project for her. I hope it'll help her get into med school. Go ahead, Sophia.
Thank you, Dr. Ram. So hello, my name is Sophia Hania Yusuf. I go by Sophia, and I work as the project communicator. So I essentially help to make the data look pretty. So what happens is that once the digital droplet reader processes all the data, and then it gets processed through Excel into these macros, and those macros get delivered to me. So we use that data to ultimately provide reports to the Detroit Health Department and then the campus health committee here at Wayne State, and a graph of public data. So we use that data to predict and track trends in COVID and just be able to see whether we might have an outbreak or not. So as you can see here is a graph on the logarithmic scale. The changes in color indicate that So as you can see here, part of the graph is blue. So that indicates that a change in the different technology that we use for RNA extraction. Previously, we had been using different one. Now we use ChemMagic. So as you can see here, the peak near in the beginning in November, that just shows that the Delta variant was present on the way in Detroit, and especially the Wayne State campus. So in response to these high fluctuations that we saw, we actually had a COVID-19 testing event at one of the dormitories. I actually took part of it. It was fun. $20 came out of it. And then afterwards, as you can see here, around December 19th, which was towards the end of finals week here at Wayne State, we again saw really high signals in the city overall, but also especially at Wayne State. It was so alarming that we told the campus health committee. They took that and the number of cases, positive cases on campus into consideration, and ultimately decided to close campus for about a month and pushing most operations online. And now, as you can see, since that closure, we've been declining, but however, as of this week, we do have a peak. A couple of other sites, particularly in East Detroit, we've been getting a couple signals, and it's pretty concerning. Just given everything that's been going on in the world. Obviously in Wayne State, we removed our mask mandate. COVID restrictions nationwide have been loosening up. However, in the news, there is a new variant called BA.2. It is particularly taking hold of China and the United Kingdom. So the fact that it's rapidly spreading over there is we usually use those countries as a way to predict what might happen in this country. So the fact that we have such high signals all of a sudden, especially during our Wayne State spring break, that is pretty concerning. If Dr. Ram would talk about these slides next.
So I just want to finish up by saying, to show you two individual sites. And I just want to say that the high sites were on the west side and the south central.
Oh, I'm sorry.
Yeah, but this is, things like that. We have to be careful at where we might identify something. However, the northeast location site that Sophia was referring to is actually the site that's here, site SG, you can see how an individual site, this is a zip code wide site, rose up. This was during the Omicron surge and came down, but the peak that you saw this week wasn't from this particular site. And just to show you how it relates to the signal we're getting from hospitals, you can see on the bottom one, this is from the sewage that's coming from the Detroit Medical Center. And you can see the peak at a place like SG, a community site, peaked at the end of December and the DMC didn't peak until near the end of January. And the earlier peak that followed a rise that happened in September. So these data did produce public health responses. Sophia mentioned the $20 incentive for students to get tested, the mostly online operations at Wayne State in January, and a couple of sites that we notified the health department in Detroit about, and they said they would give the information to their investigations and testing team to see what's going on in those neighborhoods. It's not necessarily from the nursing home because there's other sewage that comes into these sites, but that's certainly a high value site that they could look at. And this is just a repeat of my first slide. We asked these questions at the beginning, and I think we've found data that supports. We get early warning. We can also let communities know of declines, and this week that it's popped back up. I have to say, last week I went into some place and didn't put a mask on, and then I heard that President Obama tested positive, and I put the mask on right away. And then I saw our data, and I said, yeah, it's too soon to take off the mask. And Dr. Deborah mentioned about under-resourced communities. That's it. Thank you for your attention.
Thank you. Thank you so much, Dr. Ram and Safia. We appreciate your presentation. There's more information here than we can actually share, so we'll look to have you and have conversations with you further. But I did want you to mention, Dr. Ram, that there are studies going on here in Flint, and you identified those. There are some wastewater surveys happening right here in Flint. So we'll get more information on that as well. Thank you so much. Dr. Hackert, I want to ask you to come back and make a quick comment as you indicated. And Sherelle, thank you for being here with us today. It's really important that we stay on track with what's available in our community as we look at these possibilities and what resources are continuing to be available. So Dr. Hackert, would you share your point, and then we'll go into the additional updates from the health department.
Yes, thank you, Dr. Ram. That was really a nice comprehensive overview of what is being done. So we are one of the 5 sites that is working with U of M, and our numbers for, with the last one being 310, our numbers are still quite low. They have had a steady decrease since February 16th. When you look at the daily tracking, they're still going down in the last month. Also, it's showing the variant analysis is still that we are most consistent with the original Omicron. So we are getting this information. I wish I wasn't looking at my iPad for it, but you can actually do the covidcdc.gov. And so it's covid.gov. Maybe I'll type it in here for everyone. So it tells about the water surveillance. But right now, our Flint numbers are looking good. However, as we all know, once you see the rate increasing in one part of the state, you're going to see it increasing in other parts of the state.
Thank you, Dr. Hacker. And just another point with Dr. Ram's study, he mentioned that study is being done in Detroit, but it was important for us, we thought, to help our community understand these are ways that we can get the information early. We also want to pay attention to how that information is used. So that's a whole nother conversation when we talk about the ethics of all of this, but it is important that this work is being done. Sherelle, as we go forward, there's some shifts that are happening when we talk about observing what's going on right now and the shifts that are happening. We know that there's been a reduction in the number of persons going to our vaccine clinics. So we want to look at what's going on right now so we can move forward with the events that are coming up this week or in the coming weeks. We'll see a little bit of a shift.
Yes, we will see a little bit of a shift. As you stated, people are coming to the clinics in demand of the vaccine a lot less than what they used to be. And then there are many initiatives to vaccinate. So there's more entities around the county to have that accessibility to the vaccine. So Genesee County Health Department, we're going to be scaling back on the clinics that we offer throughout the weeks. We'll start a rotation of first and third weeks of the month for our Tuesday and Thursday clinics. And then our second and fourth weeks of the month will be our Wednesday and Friday clinic locations. So with that being said, as you can see on the screen, we have Our Lady of Guadalupe in place for April 5th and April 19th. So those will be the only Tuesdays in April that they'll be offered. And then Wednesday, Central Church of the Nazarene will be offered this upcoming March 23rd, April 7th, and April 21st. And all of this is on our website at gchd.us. So check that frequently just in case we do have any pop-up clinics. And then Thursdays, you all know that we are usually at Shiloh Missionary Baptist Church from 3 to 6. And those will be on April 8th and 27th. I believe that the dates on this slide aren't correct.
Okay. So what we do see here, Sherelle, that it looks like there are Wednesday dates on here. So are these going to remain Thursday? So we'll just have to correct the dates on theirs because it looks like the 13th, according to our calendar, is actually a Wednesday. And yes. We weren't sure if it was a Wednesday because of the Good Friday and Easter coming up. We just want to make sure that those dates should still be Thursdays.
Yes, it should still be Thursdays.
Okay,
so
all right, so we'll make those corrections that those Thursdays will remain for that. But we want to just key in right here. As you mentioned, Sherelle, there are some other community initiatives that are going to be going on that offer pop-up clinics more frequently in the next 4 or 5 months. And one of them is going to come up on Monday, the 21st, at Cathedral of Faith, working with a partnership. Cathedral of Faith will be having a pop-up clinic from 12 to 3. So we'll be intermittently mixing some community events, pop-up events, along with what you're offering at the health department. And so that doesn't change though, however, what's happening at our other sites, right? For testing and vaccinations.
Correct, those remain the same. The dates and times have not changed. Word of Life, Bethel United Methodist, Macedonia Baptist Church are all 3 additional local sites in Genesee County where residents can receive testing and vaccination. They have Moderna and Pfizer at these ones. And I do want to mention that we do have a pop-up clinic on Friday, April 1st, and that'll be from 10 to 2 p.m. at the South Flint Plaza, better known as the Dort Mall on Dort Highway. That's 3600 Dort Highway. So yes, there are many places that you can go to receive your vaccine in Genesee County.
And we'll still have the opportunity if people have some challenges and they want to get some other times and locations, the other testing and vaccine sites are available in the community, in addition to reaching out to the health department if they want some additional information for individuals who can't get tested at these sites.
Yes, you can visit our website at GCHD to schedule an at-home appointment, or you can give us a call at 810-344-4800, and we'll be happy to come out to the home. Our goal is accessibility, and it looks like the vaccines are very accessible throughout the community.
Thank you so much, Sherelle. And again, always, and I did hear the health department's website is under construction. They're doing some revamping. So when you go there, you may see some changes happening on the website, but they're trying to ensure that the site is accessible, user-friendly, and so some work is being done. So we want to say hats off to Dr. Hackert and that team at the health department for hearing the request of the community to make it a little bit more easy to navigate. So thank you. The last thing we want to say, you talked about tests being available, and Dr. Reynolds mentioned this, COVID tests are now available at homes. And we do want people to report the results of their positive tests to the health department.
Yes, if you go to our website, gchd.us, you'll see it right in bold print that if you tested at home and you've tested positive, there's a link that you can click to report that positive test result to the Genesee County Health Department so that we can continue on with contact tracing and just keeping track of the data.
Thank you, Sherelle. And this is all a part of our effort here in Flint, Genesee County, to ensure that we keep a local context, keep it clear what we're doing here. We need the data. And that's where the health equity brief, the health equity brief and all of those wonderful information that comes from that brief is so important to us. Mary Catherine.
Hi. Oh, so happy Friday, everyone. So more good news. So confirmed cases are still going down in Genesee County. We went from about 117 cases to 98 confirmed new cases this week. We saw a tiny little uptick in Flint, but nothing major. And testing positivity rate does continue to decline in Genesee County. So Yvonne, we're now under that 5% at 4.6%. So if we look at this another way by comparing case rates across municipalities for the month of January and February, you can really see this magnitude of change. So for example, there were about 21,000 cases in the month of January compared to about 3,000 in February. So we do continue to mirror state and national trends, right? We saw the sharp rise and fall of case counts associated with the Omicron variant, which peaked about mid-January. But also, I just want to point out that we can't forget about what we know about how the virus, changes as the seasons go. So right, it gets a little warmer, we move outside, transmission goes back up. And then, but now that it's springtime, it's definitely plausible that we could see an uptick in cases in the coming weeks. So from an equity standpoint, we really want to make sure that as we participate in these activities, that we aren't going home to visit our elders or young children or anyone who can't be vaccinated or simply have an increased risk of COVID. So it's always heartening for me to hear other experts talk about how it's too early to let everything keep going. So I'm really excited to be back digging into policy today, because I do have a couple of important pieces to talk about. So first things first, there is a Michigan bill on its way to the Senate trying to pave the way for doctors to prescribe unapproved and uninvestigated drugs for COVID. So this bill originated in the House. What it does is it amends the Right to Try Act, and it specifically adds coronavirus to the act to allow the use of essentially fake and dangerous treatments. And right, why is this so concerning? Well, we have political leaders who still refuse to accept a safe and effective vaccine, in addition to novel treatments like the Pfizer pill and monoclonal antibody treatment. And not only that, doctors who use these treatments that are not intended for COVID are actually going to be protected if something happens. So this bill, what it does is really undermines basic safeguards to medical care in Michigan. That should be an equity concern for everyone. On a brighter note, there is new legislation in the House that aims to create a reparation fund for Black Michigan residents. And so there are 3 bills that create the Racial Equity and Reparations Fund, and that would provide over $1 billion in federal money to help residents, minority or Black residents in the state, build generational wealth. And that's going to be through grants, loans, and other different forms of assistance to promote business development in minority populations. And this is so important, building that wealth, because in the future, if, God forbid, right, as the pandemic continues, or as, if a recession happens, this really protects communities who are already disproportionately impacted when we have emergencies or recessions. And I just really want people to know that this does not come from taxpayers. It would actually be created under a surcharge for certain tax credits that businesses would have to pay in Michigan. So we have a huge opportunity to create new mechanisms for building wealth and equity here. So definitely be keeping a close eye on this bill.
Thank you so much, Mary Catherine, for sharing that information. So when we talk about equity, we also talk about the importance of one's voice. And so here again is another opportunity for us to stand up, speak out, and let our voices be heard, learn more about this, and then you make a decision about how you would want to get involved. One of the ways we've been encouraged to get involved right here in the city of Flint is to come to some of the local events that the city is offering. And so Kiana Towns Williams, who is a manager of public health for the city of Flint, is here to give us some updates on the opportunities within the city of Flint. Kiana.
Yes, hello, good afternoon, everybody. Okay, just a couple of updates from the city of Flint, beginning with the one that I am most excited about. We are just over 3 weeks away from the unveiling of the Floyd McCree statue in front of City Hall. So on Monday, April 4th at 2 p.m., Mayor Neely will host the unveiling, and the community is invited to come out and participate and take photos. So mark your calendars. Again, April 4th on Monday, 2 p.m. We will be on the front lawn here at City Hall. And then I wanted to take just a little bit of time here to introduce to some of the listeners the Water System Advisory Council. And so the council was formed here back in the fall, but now that we're meeting in person, I wanted to take this opportunity to reintroduce the group. So back in 2018, when the state of Michigan did their revisions to the lead and copper rules, it created both a state level and a utility level advisory council for water. And so that committee was formed and has been meeting just about on a monthly, sometimes bi-monthly rate, even though they are only required to meet once a year. And they have their first meeting coming up for this year, which will be Monday, the 21st. It is at 5:30 p.m. It will be here at City Hall in the Dome. And so that the public is invited to participate in that meeting. The goals of the committee are to make sure that the community has a voice in sharing with the administration and with the state of Michigan any water related, and that includes lead concerns. So please, we invite everyone in the community to come out to the Water System Advisory Council meeting, which will take place on Monday, the 21st at 5:30 here in the Dome. And then finally, just a reminder, the vaccination clinics.
So can Kiana, may I ask you just quickly, if you would quickly, this is another opportunity for, as you mentioned, for the voices to be heard. So even though we have come a long way from the water crisis, initially, the voices of community have been heard. This is one of those opportunities. So as we come out to this event, you have the opportunity to share your voice. But Kiana, would you also emphasize the continued opportunity, if there still is, for the ARPA funds for folks to chime in there? Is that still open?
And so as far as I know, the opportunity has closed in person, but there's still maybe an opportunity online, and I'll have to look up the email address again. Yvonne, if you have it from last week, I don't have it in front of me, but residents might still submit their feedback, questions and concerns around the plans for how to spend the ARPA dollars. I've got water system in my head, the ARPA dollars, and we'll be able to submit those to the city of Flint. The mayor did hold the last session last week in person, but there could still be an opportunity to share feedback. And that's always important, hearing from the community about how we should spend those dollars.
Thank you so much for just re-emphasizing that. So other opportunities the city is offering?
So just one other reminder about the vaccination clinics that are still happening here at the mini stations on Mondays at Hasselbring, on Wednesdays at the North Flint mini station, and then on Fridays at the South Dort mini station. We still have testing there on Wednesdays at the North side mini station. So there's an opportunity there for vaccinations, for boosters, and also for COVID testing. So we anticipate those going through the end of March. There is an opportunity to extend them if there are requests from the community. So you're welcome to reach out to us, let us know, provide us feedback. You can give us a call at 810-410-2020.
Thank you so much, Kiana. I appreciate you for sharing that information and being available to us. It's really important that we hear from you. All of our presenters have come weekly to share their insights, their expertise. And so for those of you that are listening, whether you're listening by YouTube review, if you are in Facebook now listening to us, or you're actually in the webinar, we want and would appreciate your feedback. There was a survey that was sent out immediately following last week's survey, which was our 2-year mile marker for this webinar. If you would take the time this week and complete that survey for us, we would certainly appreciate it. It will give us some really important information as we continue. There is an opportunity for you to just punch a QR code when you go in there, and that will allow you to get right to, you can scan, and I said punch, you know, so I'm old school, right? But you can scan the QR code to access the survey. And if that's the easier way for you, especially for some of you savvy young people, scan the survey, scan the QR code and access the survey. But we really do need your feedback, and we would appreciate it so much. We thank all of you that put questions in the Q&A. It is very important that we get your questions. And I see that some of you even put some additional information that provides us some insight. So that opportunity is still available for you to put questions in the Q&A. We have our team is on hand to answer those questions for you. Every week, we offer you the opportunity, particularly for those of you who are community health workers and social workers, to receive those social work credits. I'm going to ask Mary Catherine to come back one more time. We have a new person that's working with it. Torsha is working with us, but I'm going to ask Mary Catherine if she could just come back quickly. And we want to walk you through, because some of you have shared with us that you've missed that opportunity where it's been a little bit challenging. So we want you to know, to get those continuing education units, you really need to stay on your computer just a few seconds after the close. So Mary Catherine, would you just walk us through that real quickly?
Yes, absolutely. So after you hit that leave button or the webinar ends, you want to hang out for a minute, because a new web page is going to populate offering to take you to that survey, which you do need to complete in order for us to get you those credits. You're gonna select your profession, whether you are a social worker seeking a contact hour or a community health worker seeking continuing education, and you want to complete all fields of the survey. It is very important that the email that you register with for this webinar is the same email that you enter into the survey when that field populates. You'll go ahead and click the blue button and then continue to the survey. I know that some people have had some issues, whether it's an organizational firewall. So just reach out to Atoisha. Nina's so wonderful. She'll put her email right in the chat for you guys. Just reach right on out to her if you have any issues as soon as possible, so that we can get you taken care of as soon as possible.
Thank you, Mary Catherine. This will help us ensure that you're getting your credits. This is at your request. And so we are really trying to ensure that we meet the need. We have other requests for some certifications to be looked at. So if this is continuing to meet your needs, we want to be sure that that's why your completion of the survey would be so helpful to us. I also want to share with you today that we have some really important things coming up in the next few weeks. You heard earlier when we talked to the health department that they were going to be scaling back a little bit. So in the future, a couple of webinars from now, we will have representatives from some of the organizations, our community organizations, who have been funded to make sure we have additional pop-up clinics available. We're often hearing that there is a difference in how people are able to access, and that's that equity issue, right? When we talk about differences and disparities. Our goal with the community efforts that are being made with a number of the partners that you see coming here every week is to reduce those differences that prevent everyone from having access to, whether it's healthcare coverage, access to vaccinations, access to testing, access to whatever resources our community needs. Many of our partners are actually working very hard behind the scenes to get this information to you. There are also many other research projects that are happening. The Healthy Flint Research Coordinating Center, our goal is to ensure that research, when done in community, is done with community and not without community, and has truly a community benefit. This is again why we say this community webinar on coronavirus is to bring a local context to the global pandemic. If no one else talks about it anymore, it is important for us to plan well and to think about how we will improve the quality of life for our community. That means, as Dr. Reynolds said earlier, all of us taking the time to make well-informed decisions when we're in the particular environments that we are faced with. I'm not there with you. You have to make those decisions. Our goal with the webinar is to give you the tools that you can make decisions best for you, your family, and ultimately, these will be the solutions that we have for our community. So we want to appreciate you today for joining us. We want you to like us on Facebook, subscribe to the YouTube channel Healthy Flint, and then email us with any questions that you might have at info@hfrcc.org. We encourage you to give us a call. If neither of those other venues mechanisms work, give us a call at 810-835-2130, and we'd be happy to answer them questions for you. Join us next week, session 106. We'll be right here. Looking forward to your participation. Thank you for joining us today for the Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus. All right, team. Thank you, Dr. Wolford, for getting that, my goodness, how do you get all of that out of your kitchen?
No problem at all. It's such a pleasure to spend time thinking about it. Of course, I'll be eating cauliflower for days now.
Okay.